loss of smell in long COVID patients could be a sign of decreased brain activity. A new study shows COVID is causing changes in the areas where the brain detects and helps people to understand what they're smelling. But that's not the only symptom of long COVID, which affects a lot of people. The U.S. is reporting more than 6% of American adults are currently seeing long COVID effects, or rather long-term effects from the coronavirus. So I want to bring in a Jodie Guest to talk a little bit more about long COVID. She's a professor at the Rollins School of Public Health at Emory University in Atlanta. She's also the vice chair of the school's Department of Epidemiology. Thank you so much for joining us today. We talked so much about long COVID, I don't know, say a year ago, and warned that this would be an ongoing issue, and then we don't talk about it anymore, it seems. This is the fourth consecutive month where the number of Americans facing long COVID has shrunk. That is good news, but why do you think that's happening?
Well, hopefully that's because COVID cases have been going down, which is a great sign for us to be looking for. But what we know is we still have about 28% of people who've had COVID who are experiencing symptoms of long COVID.
I should
and
clarify.
That's still a tremendously high number.
Sorry, not to jump into it, but I should clarify because my question was incorrect. In fact, the numbers have not shrunk. So that is concerning. Yeah.
Right, exactly. So we're seeing COVID cases go down, but again, about 28% of people who've had COVID are experiencing symptoms of long COVID. And again, that's a really high number. That has a tremendous effect on our workforce as well, as we think about people who have real problems with daily life.
So, the thing about long COVID is it seems like there's a laundry list of symptoms. How does someone know if you have long COVID? Because I think anyone who's had COVID now, if you feel a little drowsy, if you have allergies and you didn't before, you start to wonder whether or not it's connected to long COVID or to COVID.
Absolutely. And I think one of the problems with long COVID is we certainly don't even know exactly how many people have it because the signs and symptoms can be very vague. They also can just feel like a continuation of your COVID, and you don't really know when you need to move from I have COVID to I have long COVID. So what we're looking for are people who have persistent symptoms, and this tiredness and fatigue is actually the number one symptom, which again can feel really vague to a lot of people. But when it starts to affect your daily life, if it gets worse after activity or even mental activity, that's something when you want to seek some help and talk to a clinician.
2 weeks ago, President Biden signed legislation ending the national emergency for COVID-19. What sort of impact do you think that could have, considering the number of people who are still struggling with these symptoms?
So that's really a policy issue, and there's a difference between what we're seeing from public health side and the number of people who have COVID-19 versus the policy. So this is a way to change the way money gets to certain places where they have supported people in extra ways during the pandemic. So we'll see some changes with telehealth. We'll see some changes with access to testing and vaccines. Most of these changes will be drawn out. If you have Medicaid and Medicare, most of your services you've received for COVID-19 in the past 2.5 to 3 years will be protected at least through the fall of 2024. It's really our uninsured population in the United States where we're going to see the biggest impact. And we need to make sure that everyone gets up to date on their vaccines as quickly as possible. And if possible, signs up for an insurance coverage.
Doctor, because of the nature, I think, of long COVID, sometimes when people are suffering, it's difficult for them to convince others that they actually are sick. In some cases, it can be very debilitating. What have we learned so far about long COVID that can give people hope? In terms of treatment or lifestyle changes, or is there anything new that we have learned that could accelerate getting out of this?
Well, I think one of the biggest things is to acknowledge that it does exist. And there are a lot of good support groups out there now for people who are suffering from long COVID. And just having someone say, yes, we hear you, and yes, this is a real thing, it goes a very long way to helping people who are suffering from it. This falls in the same sort of category as chronic fatigue syndrome, which again is hard to diagnose. And a lot of people who suffer from this have had trouble getting diagnosis and getting people to believe them. So we want to make sure that there are good support systems and that there are long COVID clinics available for everyone to go to when they are suffering or have questions about it.
Yeah, I think that is spot on. That is the first step. You're not losing it. You're not crazy. You probably have something that's diagnosable, and there's help out there. Dr. Jodie
That's right.
Guest, thank you so much, doctor.